Josie from Black Fella DC Body Sculpting and Wellness Studio here in Maryland, just outside of Washington, DC. Today I would like to talk about post-operative care. So right now, tons of us are having augmentations, liposuction, BBLs, fat transfers, tummy tucks, facioplasty, just tons of things, leg plasty, abdominal, back rolls, just lots of surgeries. Great. I am a proponent of surgery. I feel as though if you're healthy enough per an MD's orders, and it's like right place, I think surgery can be a great tool. There's parts of our body that it's very, very difficult to augment and maintain, like that little smiley face lower belly area. While we do offer non-invasive treatments, sometimes you want to just get straight to it. You don't have time to waste, or it's a makeover and things of that sort. So again, I support the surgical journey 115%, and I'm excited to partner with folks when they want to do the post-operative recovery portion. So with the post-operative package at Black Fella DC, we modify the treatment in accordance to your surgeon's orders, one, and also your body's orders. So where you are in each stage of recovery, we'll pair different treatments and services to match that. With our post-operative care package, we include circulatory massage work, lymphatic drainage, and ultrasound cavitation when applicable. And when you're further down towards the end of that journey, we may incorporate a little bit of radiofrequency skin tightening and things of those sort as needed. Pardon me. And also, if you have like little pockets of fat that aren't quite symmetrical, which is pretty common, we'll help you with reducing the size of the fat cells in those areas to give you a more even and smooth finished look. There's a lot of different ways to treat the post-operative care, but one of the things that I hear most from people is they don't seek post-operative care because they think it's going to hurt. They've seen videos, they've heard stories, and quite frankly, some of the things that practitioners are doing are not in accordance with lymphatic drainage. So the lymphatic system is a network throughout your body. It's a cleaning mechanism which is superficial to your muscle. So when I say superficial to your muscle, your lymph nodes and lymphatic system is, for example, this is your skin. This would represent your muscle. All that area in between that subcutaneous tissue is where your lymphatic system lays in your body. So if you think about it, if I wanted to excite your lymphatic system, you are literally rocking the skin. Think baby's head, just moving. If I were to press deeper into that tissue, I'm hitting muscle. This is a massage, not lymphatic drainage. So if you see someone saying that they're doing, number one, a lymphatic drainage massage, that's really not correct terminology. Massage is more a muscular rhythmic treatment. Lymphatic drainage is exciting only the lymphatic system. It's a gentle, again, think baby's head, the top of a baby's head, the amount of pressure that you would put there. You're literally taking that skin and subcutaneous tissue and activating it. It's not a painful treatment. When people come in for the lymphatic massages, I've had people ask, should they take a Percocet first? All this crazy, wild stuff. I see people online applying wood tools. I own them, I use them, I have them. I use them when applicable. After surgery, your body is in an acute stage of injury. You literally went into that subcutaneous tissue that we talked about and ripped all of the fat cells that were nestled there, very nice and comfortable for however many years, minding their own business. You went and suctioned all of that tissue and fat and lymph nodes out, exciting the nerves, causing the fluid to dredge in, and attempt to heal itself and do all these other things. Like, your body's going to do what it's going to do. Your body's going to heal at its own rate. The benefit of the post-operative care is that you are facilitating that healing that your body is going to have, and you're accelerating the results of it and kind of just helping to usher it along. The way that the lymphatic system works, and I'm sitting right in front of my poster. I have these in each one of my 4 treatment rooms because everything that I do is based on the lymphatic system. All we're doing with these treatments are manipulated systems that are already naturally occurring in your body. When you're post-surgical, you are, depending on which parts of your body you have done, you're activating those collector lymph nodes in the groin, in your core, and possibly under each arm if applicable again, and in some cases under your neck and throat there. So the practitioner, me in this case, would be skilled on BODR certified and licensed and insured. And those are things that you guys really should be looking at when you're choosing people to do body work on you. It's your body. You're building children in these bodies. You only get one of them. It's very curious to me that people would go to a practitioner to get body work done and their full name is not even disclosed. That's interesting. When you go to your doctor, you see that doctor's first and last name up on that wall, comma, MD. Why would you go to a practitioner with a nickname? We just need to start there, kind of really bare bones. If someone's going to be manipulating systems within your body, changing anything in your system, activating any type of response in your body, they should be licensed and they should be insured just in case something, whatever happens. And it's their responsibility. So I don't care if you're doing just a simple fat reduction treatment, a back lift, massage work, lymphatic drainage work. Before someone is touching your body, you should be able to vet that person. You should be able to go to the Department of Health in your jurisdiction and pull that person's first and last name up and say, oh, okay, I can see they are licensed, they're legit, or whatever else. There's a lot of other things that we'll do where we vet the practitioner or the professional and check them out. But in this arena, it's an emerging market, it's new in a lot of places. A lot of people aren't checking out the people who are doing work on their body. And in the state of Maryland where I am, and in DC where I am, you need to have a bodywork license to do such practice on people, not esthetician. Esthetician is kind of décolleté and up. Body work. What do you know about the full organ systems, the lymphatic chamber, the lymphatic system? When you do X to a body, what happens? Y and Z. Those are the things that I like to challenge people to ask me about when they come to me and they want to do anything, especially post-operative. People are in a very delicate state. But back to the lymphatic drainage. So when you're having a post-operative care, it does not hurt. Number 2, you feel the difference right away. My tools of trade are these. I use a little bit of a blended essential oil, and I have my Moroccan argan oil that I brought back with me. Pure as heck. This stuff is so really good. So I dilute it a bit down. Sometimes I use this over-the-counter arnica oil. And then I have a ton of products for my post-op care people. I have several styles of fajas. I have a good friend who's a seamstress across the street. When you get those garments, stage 1 and 2, let's work them. You don't need to buy 5 and 6 different fajas or girdle garments. My friend will take them in for you as you shrink down in size. He's just across the street. You could drop your garment off, come over, get your lymphatic drainage treatment, go back, get your new closely fitted garment, and be on your way. I also stock arnica creams. I prefer the creams over the gels. They get tacky after you wear them for a while and sweat. I can recommend different lipofoams. I have scar tape. There's just so many different resources that post-operative people can take advantage of. When you have that surgery, it is a major investment of your money, your time, and the risk. You only get one shot at recovery. I say choose wisely. With my plan, it's affordable. I offer a payment plan. I even have a bundle where you get an extra 6 treatment free. If you do like a package, I have a package of either 6 sessions or 10. And what's included for me, I start out with full body circulation. So I would do normal effleurage massage, just getting the blood to flow, introducing you to my touch, getting you in the space and getting you kind of comfortable. And then I incorporate opening up the lymph nodes wherever applicable, and I begin my lymphatic process, the Vata process. And when you get up, I tell you, everyone, they come in walking like that, they leave and they're like, oh my God, oh, wait a minute, hold on. It's amazing. That's the best part of my job. I love it. I just want a lot of folks to know that post-operative care should not hurt. It should not, things that you would not do to a body who's just had surgery would be apply heat. Heat vasodilates the veins in your body. Heat promotes swelling. So heat feels great. It's almost like when you scratch and it feels so good, but it's kind of hurting and turning red. That's like a little mild form of injury to the tissue there. Heat is not good for post-op care. So then you would not apply rigorous heat to already acutely injured tissue. You would not apply pressure with ridiculous, outrageous, rough massage work to acutely injured tissue either. I would just tell people, if you would like to try a treatment or two, I have a per session option as well, because some people don't want to commit to a package. I'm pretty flexible with things. But when we look at the lymphatic system, I would like people to know that it is a superficial system within your body. To activate the lymphatic system, it does not, you do not need to inflict pain, a ton of pressure, heat, or anything rigorous and crazy as seen on TV. I know in other countries, they do things differently, and especially when you're in a recovery house, understand that what happens in a recovery house is not lymphatic drainage, it is drainage. So when you just come from surgery, especially an aggressive liposuction treatment, they'll give you what's called a 3D massage. Some surgeons still use drain ports, so you'll have the ports in the little pouches here, and they'll change those after you get so many cc's each day. But nowadays, a lot of surgeons aren't using drains, they manually drain. So they'll have a girl come in and they'll call it a massage. It's really drainage. So they're helping that skin to bind down to that muscle by forcing the fluid out. After about 2 days of that, 3 maximum, your drainage is now happening through that lymphatic chamber. I'll tell you a little bit more about that. Once you have dredged the body, pushed all the lymph up into the collectors, up into the lymph chamber where it goes down deep into your vas deferens, and it starts to dissipate. It's going to work through your endocrine system and your digestive tract. So where everything is going to go is through your sweat glands, goes into the filtrate, turns into urine, comes out, works through your pancreas and everything, into your bile, comes out with your solid waste. So in short, you're going to pee, poop, and sweat it out. So after about 2 or 3 days, you shouldn't be manually draining anything. You're pee, poop, and sweating out any leftover fluid that's in that lymphatic chamber. Your body's already set up for this. You don't need to be in it. I've heard horror stories, people going in, opening the incisions on their arm and squeezing stuff out on their desk at work. Disgusting. Do not open surgical wounds. You are at risk for infection. There was a surgeon in DC recently sued because someone had a staph infection because he drained her over a wastebasket. It's easy to get infections. An open surgical wound is very, very volatile. So don't be at home trying to open stuff up, trying to squeeze and drain yourself. I don't recommend it. And if someone is doing that for you, they should be in a semi-sterile environment. They should be a nurse practitioner or a surgeon or some sort of qualified MD with a very valuable reason as to why they need to physically pump fluid out of surgical wounds in your body. And I would also recommend, your surgeon should be recommending to you who is doing those things. You don't go and have a $10,000 surgery or even a $4,000 surgery somewhere and then come to a whole nother jurisdiction and find someone in a dark room who says they're going to squeeze something out of a hole in your body. Think about what's it. You may as well go and get illegal butt shots. I mean, what sense does it make? It's your body. It is your temple. Your body is in an acute healing stage. You need to be focused on anti-inflammatory, relaxation, detoxing, and compression. Those are going to be your friends. And a little bit about compression and why you need it and why it works is, again, skin, muscle, all of that in between. When you get that surgery, all of that subcutaneous tissue is trying to swell. The only way to prevent that swelling is with smooth, even pressure. That's what the faja, or that girdle garment, does for you. It applies the pressure to the skin to help it bind down to the muscle. That is critical. People come in, how long am I going to have to wear this? It's going to be your best friend. 23 hours a day for at least the first 4 to 6 weeks. But most people are in their faja garment for about 6 months-ish. You feel the difference. Be in tune with your body. Listen to your body. Your body's going to give you all the information you need to know. That's how you know how long you need to wear your compression. Your doctor's going to give you recommendations, but if you know that you put your faja on, your body feels great. You can move around a lot more. You're not as hard and stiff in the evening. That's an indicator that you need to be in your faja all the time. Yes, take it off, go to an event, do what you do, have a good time. But again, you only get one chance at recovery. Use the lipofoams, get the fajas reduced and adjusted to make sure you keep constant pressure, smooth out bulges and bumps. I don't agree with the medical binders that some surgeons give, especially in the US. They're these white, rigid garments that leave creases in your flesh. Whenever you see creasing, you want to pack lipofoam around. Lipofoam is cheap. You can get it on Amazon. I sell it here. Or worst case scenario, you can get the giant size cheap maxi pads from like Walgreens, Walmart, or what have you, and just pad, because you don't want anything, again, it's going to leave creases, uneven dips, or anything in that tissue while the swelling is there, because it is a chance that that little dip can form around the bulge. So you don't want any inconsistencies there. And the other big thing with post-op is diet. So anti-inflammatory is your friend. Things like turmeric, ginger, fresh pineapple, just different herbals. Anything that's anti-inflammatory is your friend. Stay away from the sodium. And no, you cannot drink. I love when they say just one drink. I mean, you could try it, but just be sure that you reset afterwards. Have yourself a nice cleanse, like a detox tea, something kombucha, just whatever it is. But you have to take care of yourself. You're healing from an acute injury, pretty much. So Black Bella DC is here to help and support you on the journey. If it is not us, please choose a good partner and be well. Black Bella DC, have a happy holiday.